the data and the insights around personalized care is going to manifest a lot quicker than the ability to do something about it. And that's probably going to be an industry challenge we're going to have to face over these next few years.
New choices, new players, new models of care. You know, consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 369. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about more new research on consumers' healthcare perceptions, this time from PwC. As we add this newest research to volumes of data over the years, and that data confirms trends that we've known all along, what will be the compelling event to convince health systems to do something about it at critical mass? I'll talk about that. Then Zain and I compare notes on 2 recent events we attended. You'll hear my take on the health conference, and Zain will share what he saw and heard at Sanford Health's Future of Rural Health event. It's time to dive right in. Are you ready? Let's go.
Flava of the week.
Guess what? Consumers want you to make healthcare affordable and easy to use. PwC's 2024 U.S. Healthcare Consumer Insights and Engagement Survey delves into a complex interplay of factors, from ongoing consumer concerns over affordability and access to consumers' adoption of tech-enabled healthcare and trust in the healthcare system. 4 key findings from the survey capture healthcare cost and navigation problems still in need of solutions, as well as opportunities to help educate and engage consumers in preventive health and provide the care options they prefer. The 4 numbers to remember are 28, 50, 65, and 80, meaning 28% of consumers skip, delay, or stop care because they can't afford it. 50% of consumers ages 55 to 64 prefer a doctor visit over virtual visits. 65% of consumers don't seek care until it's urgent. And 80% of consumers ages 18 to 34 are willing to use generative AI in healthcare, compared to less than 60% of consumers over age 55. I know that was a lot of numbers, and don't get me wrong, there's a lot of nuance in the data that I'll be diving further into next week. But I also had a reaction of, well, it seems pretty obvious, doesn't it? We've been seeing research reflect this general trend for the better part of a decade, accelerated particularly since 2020. In many ways, consumers are relearning how to engage in their health while raising their expectations for the overall experience. So here we are seeing more data, which on this show we've been reporting on for years. And I definitely want to say we should keep paying attention to it because it reflects trends that we've seen for a long time. At the same time, I don't want to stop there. I want to compel the industry to move to the next phase of consumer transformation as quickly as possible. So the question is, as we add this newest research to the volumes of data, and that data confirms trends that we've known all along, what will be the compelling event to convince health systems to do more about it, to quicken their pace to a critical mass of adoption? When will consumer-centered experience design not be seen as an innovative strategy only for early adopters? When will it become a true industry standard, much like websites and EHRs? We need to get to the point where the early majority and late majority are investing in experience orchestration. It will take more bravery to resist the status quo of how health systems engage with consumers. And if you're wondering why, you can check out this entire season of the podcast, starting with episode 331. The TLDR is that the role of a hospital or health system is changing, and the more that leaders understand a consumer's universe of holistic health and wellness choices, the more quickly they'll understand the need to invest in experience orchestration. Waiting to reacquire patients months or years after their last encounter, while so many are looking to engage in their wellness on a daily basis, is just missing the mark. And the elephant in the room is that it takes more than a rebranded website, CRM campaigns, or TikTok videos to engage in meaningful ways. It takes better experience design and better execution, all founded upon a renewed definition of digital engagement. So while we aren't there yet, I'm encouraged as long as we pay attention to the data, because it's been sitting there in front of us all along. Let's push the industry to invest more consistently in experience orchestration as we pay attention to research about consumer engagement. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. Zane, we've both been traveling different directions lately, but how have you been?
Good. Honestly, I just got back yesterday evening, so I'm trying to find my footing again. And what day is it? Where am I? What time zone am I in? But everything's good. How are you?
Good. So did I follow you correctly? Detroit to Sioux Falls?
That's correct. Through Minnesota. You can't fly there directly from Detroit, but I was down with the team at Sanford Health at their Summit for the Future of Rural Health. And so our listeners might remember that it's their last year. So yes, down in Sioux Falls, South Dakota, beautiful community, a little warmer than last year, and was there with the Avia team. So I had a good time.
Fantastic.
And you were in at Health, right? I'm pretty sure I saw your staffs.
Yep, from Phoenix to Las Vegas myself. So it's like we were going different directions there. But what we want to do today is actually compare notes a little bit. And I have a feeling we're going to land on some of the same themes. I don't know for sure, but just from passing, talking about this and seeing some of the things that you shared, what an interesting time in the industry, first off.
Absolutely. I mean, there's definitely no lack of events, obviously, and it seems like there's more and more. And I've noticed too, some of the leaders that I think we've brought on the podcast before, and even that we work with in our day jobs, are starting to attend different events that aren't necessarily healthcare anymore, which is interesting, particularly as generative AI and broader concepts in CX and consumerism are becoming more ubiquitous in healthcare. So it's interesting to see, but I mean, we'd love to hear how things went at Health, and then maybe we can talk about what went down at the Future of Rural Healthcare Summit in South Dakota.
Perfect. Yeah, let's take them one at a time, and I think we'll connect some dots here. I agree. I think the further we get, maybe another year or two of conferences, as we start to see, you brought up generative AI, for instance, as we start to see a more general understanding, it feels like it's happening super quick because of the explosion of tools involving any type of AI, especially generative AI. But I think if we get another year or two into this, I think we'll see even more application of those technologies instead of a focus on, look, there's a new technology, and we'll see that that's a means to an end. What can we do with that? Where do we plug it in? How do we help it do things that we already do better? And how do we use it to do things that we were never able to do previously? So that's definitely one theme as I think about what I saw and heard at Health. But I will say it wasn't the focus.
Really interesting. Tell me more.
At Health, what I saw was GLP-1s everywhere. Everything from consumer brands that we don't normally hear about. I think some of them we are used to seeing at Health or at healthcare conferences, at least. But as I list off some of these, I listed them in the Flava of the Week a couple of weeks ago, but Zain, was interesting. So there's some that you and I wouldn't be surprised at all. Kroger, Albertsons, CVS, Walgreens, right? No surprise. But then it was this combination, and I think the proliferation of them. So brands like Noom, Peloton, Weight Watchers at work, Aura, PepsiCo, Bayer, 23andMe, Instacart Health, Uber Health. Then we had Zappos at work, and I had Hilton Rewards there. I'm like, what? Yeah. So I think that number of those types of brands, the growth of them was an interesting insight. And the fact that a lot of things that were bringing them together were this desire to speak with employers, speak with health plans. So not just health systems. I think the multiple entry points for a health-based solution, a preventive solution, something that's a wellness program, a workplace wellness program, or a retail health, so these non-traditional entities that are offering some kind of healthcare service, trying to get in. The fact that they're taking these multiple entry points, there seems to be growth there. A lot of them have been trying to come in from multiple ways, meaning, do they partner with the health system straight up? Do they partner with a provider organization? Do they partner with a health plan? Is that where it makes sense for them to first be engaged with by a patient or member? And so a lot of the conversations that I was hearing and just things that I was seeing on the exhibit hall floor and sessions as I was walking by were along those lines. And so a lot of those brands I just named off had different levels of investment and interest in healthcare ultimately. But having more household brands, consumer-facing, trusted brands in the space, I don't think is a bad thing in this way. It could be, if it just gets out of control and folks who really don't belong in the space try to get in the space. But that wasn't my feeling this year. It was just, I'm like, oh, I wouldn't expect to see that many different brands here in the space. So I don't know what did that, I say Hilton Rewards, it said like Zappos, Weight Watchers, was that a surprise? Would that have been a surprise to you if you had seen them there as well?
Yeah, I'd be curious what their reasoning is. I know there's some employers working on reward programs. And so I wonder if maybe that has something to do with it. you get rewards with Hilton or Zappos or something if you complete some type of health related activity. But I would not have pegged them as people to be there. I've heard through the grapevine that I've never been health, but I've heard that, health can bring in some celebrities as well and some interesting entertainment. What was that like? Was there a lot of things to do besides just sitting in sessions? And was there also like a lot of demonstrations of any sort, like kind of showing and telling technology, or was it very much presentations and panels?
No, there were demonstrations. They were more on the exhibit hall floor, though. There was Kroger offering vaccines on site. There was, Kroger also having like an actual fruit stand in their exhibit. Loved it.
No way.
23andMe was offering an actual, like a total health screening. And those who listened into last week's episode with Nora Abul Hassan, their VP of genomic health, was really interesting to hear. So it wasn't just, we know you can get some basic genetic information about yourself, but it was like really eye-opening to me that what they referred to as their total health service, their membership there takes that information and actually does make it actionable to those who are interested. And they're very real of like, this is one part of a health directive. Like it just helps you see what your trajectory is naturally compared to a baseline there. And then go from there of like, if these things hit, you can expect to have some kind of health event in your lifetime. That's just the odds. Everyone can.
I don't know if I'd want to know.
Well, and I think it would be at whatever level that you want to know. Noom had an interesting scan where, so I have a friend, I have a couple, a husband and wife who are about, they're in their early 40s and they are doing great. Like their examples to me, every day they're calorie counters and they're logging it into an app. For my salad that I had for lunch, it was, 2 slices of avocado on it. It was, this type, it was romaine, it was this many ounces, but they've been doing it so long that they kind of know what the serving size is and generally how many calories it is. They don't even have to look it up most of the time. And I was sitting here like, I love the idea of that, but I have not done it. And the thought of manually entering that in every day has been an obstacle for me.
Yeah, it's a lot
to actually have that information. And so Noom introduced an AI-based scan that can look at a salad. It can look at just about anything. You just take a picture of it and it logs everything for you.
Oh my gosh.
So it can even say, hey, the salad itself, the dressing that was used, the olive oil that may have been used to cook the chicken in the salad, like it knows all of it. You don't have to log it in yourself.
That is awesome.
That's a game changer type of thing for me. That is one of those behavior changes that has gotten in the way of me. Like I know generally, this is good for me. This is not, but I haven't tracked it in the same way very much. I've tried it a couple of times in my life, but like I said, I didn't take the time to do the tracking. So I think things like that are interesting.
Yeah, I'm in that same camp. Like I've used MyFitnessPal in the past and even Fitbit to track calories, but I always just get bored, or not bored, but too lazy to like scan the food. And I know you can scan the barcode, but sometimes it doesn't work and you got to pick the portion. So I think that's really encouraging to hear that Noom has this technology.
Well, and the one other thing I'll point out, because we all know health is known for both the ability to bring in everybody around health tech, and then also the excess of the show itself. It's well known, it's well documented. Sometimes it gets a little much. We're like, a colleague of mine even posted a picture of like all the candy trays and bowls at exhibit, booths still, and we're like, this is a healthcare conference, right, guys? Like, just remember. Which is funny. So that I think that's maybe why Kroger's fruit stand did stand out to me, because I'm like, that's real food. And that part was interesting. I mentioned GLP-1s, right? And I think that was the other connection or theme that I was paying attention to, because you had several folks who we've had on the show now, Omada, Form, and so a lot of other weight loss based or diabetic management and treatment based digital health programs. They're in attendance and speaking. And it wasn't just what I liked, the debate didn't seem to be a blanket statement like we heard maybe a year and a half ago of, are GLP-1s good or bad for me? It was very much nuanced. Like the discussion has evolved to the point of there are other things to be interested in about those who are prescribed them and then can't afford them. And not only the medical, but also the psychological withdrawal that takes place at that point. So the emergence of GLP-1s has just put a lot of digital health programs and memberships in a different place mostly for good, I'd like to think. But again, I know I'm an optimist sometimes to a fault of what can be the good and the outcome of things. So I think we're taking steps in the right direction. Ultimately, I think health was a showcase of some of the ways that healthcare is truly evolving to health, to preventive, to let's do our best to not cause ourselves to have any additional conditions than what we already have to deal with. Let's see if we can avoid care. Let's see if we can stay ahead of it. And that, of course, is something you and I have been talking about for 4+ years now. So I think it was interesting to see that in action a little bit more than what I've seen in the past.
That's awesome. Well, last time we were at a conference together, it was HIMSS. Well, I wasn't at this conference, but it's leading up to my question. And we got an invite from Zoom to go to Universal Studios. So curious if you did any really cool extracurricular stuff, or were you just totally at the conference the whole time?
I did go to one of the secret, you can't call it a speakeasy, but it was like a secret hidden restaurant inside the Cosmopolitan that I hadn't been to before. I literally walked by it twice, and the gal who was there sitting there just looked like a counter. You know, it was looked like a pawn shop on the 3rd floor of the Cosmopolitan. And she probably saw me walk by twice. I'm like, that's the name of the place. And I finally walked in, and she's like, yeah, it's the door right there. It just looked like the wall. So, I mean, an entire restaurant in the back after that for a meetup with some friends. So it was super fun to just experience that side of Vegas, you know, a little.
Sweet.
Yeah, a little in there.
And where was most of the event held at? The Cosmo or somewhere else?
The event was held at the Venetian Expo Center. So the convention center. So where it's been in the past.
Nice.
Or where HIMSS has been in the past too. So yeah, super.
That's where CES is. We'll have to take the podcast down there at some point. That's in January. We should talk about it.
Yeah, we should. So I know we were going in different directions geographically this last few days, but love to hear more about your experience with the future of rural health. Tell me all about it.
Yeah, so I was down again in Sioux Falls, South Dakota, which is a lovely little town right on the Big Sioux River. And this event was hosted by Sanford Health by invite only. And so our team at Avia was able to get down there, receive the invite. And so primarily it's an event where Sanford Health, which for those of you that don't know Sanford Health, I think you need to look into it. Sanford Health, in my mind, is very underrated. They may not I think they're increasingly getting attention in kind of our circles, but they're I think they're the largest rural nonprofit system in the country and have a significant footprint in North Dakota, South Dakota, parts of Minnesota. I believe they'll be merging with Marshfield Clinic, and so they're expanding. And so for those of you who don't have them on the radar, give them a follow on LinkedIn and just start to follow what some of their leaders are up to. But essentially every year, this is their 3rd year doing it, Bill Gasson, their CEO, hosts this event where they bring in Sanford Health's partners, Sanford Health's leadership, key partners in technology, consultants, academic institutions, anyone they're kind of working with broadly, in the innovation bucket and advancing access to care. And then, of course, the media is invited and elected officials. And so it's a pretty short event. It's, a 1-day solid agenda of panels and speakers, just talking about, various topics, which we'll get into here in a second, but also linking back examples of how Sanford Health is truly moving the needle as it comes to innovation in the rural context. And as you know, and everyone who listens to the podcast, that's where I started my career. And so in rural health in Canada. And so it was really fun to be in that room. I wasn't part of any of the conversations. We were truly just spectators, which feels nice sometimes. I feel like you and I are always speaking. And so it's nice to just sit and listen and observe. And then saw some familiar faces. I'll get into what we talked about, but Dr. Edie Cunningham was there from Providence MedPearl, who's been on our show. And so it was nice to see her as part of the panel and get to wave at her from the audience. But in terms of topics covered, some of them were similar, I'm sure, to what was talked about at Health. And so there's a number of panels focusing on innovation, AI, and the future of patient-centered care. There's a panel specifically talking about specific opportunities around delivering value for patients and communities in a rural setting. And what I think is interesting about the context of rural, it's not usually just about the person or the people that these health systems are serving, but it takes a true community focus, right? Because a lot of these health systems are the largest employer in their community. In a lot of cases, they actually know their patients, literally it's their friends or their family. And so community becomes it's not just lip service like you might see in more metro or urban centers. And then one of my favorite portions of the day was kind of a rapid fire panel with Dr. Cunningham and some folks from the venture space and actually from Amazon Clinic as well, where they kind of went through some hot topics and talked about, they did a red, yellow, green, like red, you think it's a bad or not, don't think it'll be a topic that moves forward, yellow, in the middle, or green. And so I can share more about that in a second. But going back to the top, when we talked about trends around innovation and AI, some of the big topics that were spoken about, first around virtual visits and how there seems to be in the industry more of a push or more of a focus around standing up more robust virtual care programs within hospital systems. And we see that in our business every day. I think when we had Jen and Sarah here from Avia talking about benchmarking, that got brought up. But the caveat there was adding now at-home care testing to it to be able to then develop more comprehensive programs that really allows you to do so much more. And of course, in the rural setting, going in to get a diagnostic might take hours, like it could be hundreds of miles right before you get to your next testing site. And so they really talked about the importance of these at-home care tools and self-management tools in addition to the virtual synchronous or asynchronous virtual visit as a key driver in rural health. We started, and this is a space that I'm no expert in, but probably need to learn more about, is they actually spent some time talking about how Sanford Health, again, being this massive platform spread out across 3 or 4 states, is able to start helping with decentralized clinical trials. And so they spoke to Sanford's ability to do that, but also how pharma is going to start to use LLMs and chatbots and or ChatGPT or you name it to start to actually do drug discovery as opposed to just using it for back office support. I'm nowhere near qualified to lead a discussion on that. So that's all I'll say about that. But very, very cool. This was, I would say, a summit where I was hearing things that I wouldn't typically hear if I was at HIMSS or another more digital health focused. And so that felt really good. The other anecdote that was shared that I didn't realize is, I guess, ChatGPT, just speaking to the power of these tools now. I know in some circles we still distrust these tools, that they don't give the right information, but really they're improving, I think, far beyond some of us even realize. And so the speaker said that, by the way, did you know that ChatGPT passed the medical exam with a 98%? And on the questions that it didn't answer correctly, it offered reasons why those questions were framed incorrectly, and therefore the LLM probably got the wrong answer. And so I thought that was really interesting, and it made the crowd sort of laugh a little bit. And then it was concluded by talking about the FDA. The gentleman that was speaking, I apologize, I don't have his name, but I believe he was from the FDA originally. And what he was saying is the FDA now is going to be spending a lot of time thinking about how to actually, evaluate or monitor some of these large language models. And what he said is the FDA needs to move away from understanding how the model was created. That's less relevant. What's more relevant is making sure that it's validated and that it works, so that it's as good as a physician or as good as a nurse, where typically the FDA model is to dive into a device or a piece of software and understand how it works. And again, he hit home that you could never actually understand how it works because I guess they evolve. Again, outside of my sphere of expertise. But he said really where they should dedicate their time is just making sure that it's validated and to what degree. And so basically, don't worry what's in the black box, just worry about what it spits out and is it close, right? Shake the 8 ball, yes or no, as long as it says yes when it should say yes, or no when it should say no, that should be good enough. But I thought that was a really interesting panel. Jumping then into a sort of rapid fire panel, 2 things that I wanted to bring to our audience today, because I disagree with them a little bit. Somebody asked, actually it was my question, you could submit questions. So I asked the panel, what do they think about drones and their prevalence? Everyone put up a red, which means that they don't think they're going to go very far. And the reasons why this esteemed panel thought they wouldn't is because it's expensive and, weather in rural communities and snow, you name it, wind, you name it, may not be conducive to drone technology. But as I was sitting there and, you and I have interviewed the team at Zipline and have been following their journey, what I realized, Jared, is some of these health leaders don't realize that groups like Zipline and others really are their full package. They're not just some drone you'll buy at the store, but they're actually really sophisticated logistics systems that include the drone itself and everything else that supports it. And so I couldn't imagine that the team at Zipline or others haven't thought through, okay, what's the impact of weather, wind in planning the right flight path? And I don't think health systems realize that all of that is part of the package, if you will, when you decide to partner with the Zipline to start delivering medications. The other big piece, too, is it may not make financial sense to deliver, cold meds through a drone. I don't know what the per unit cost would be. And I get that. But again, I think the summary there, at least from my vantage point, is I don't think health system leaders fully understand the services and the products. And so if, health systems listening today, I would encourage you to take a look at what these vendors are actually bringing to the table. And I can trust you, it's more than a drone that you'd pick up at Walmart, right, and fly off your iPhone. And so I wanted to put that out there. The other thing too is someone brought up wearables, like where do we think these are going? And again, the panel answered kind of red to yellow, so not super enthusiastic. And the rationale is because they think that some of these wearables, be it Oura or you name it, Fitbit, Garmin's products, Whoop, you name it, are just too niche and only appeal to, a small amount of people, which I could understand. Like probably your everyday person isn't necessarily wearing these. They also complain that the data is more consumer grade and not necessarily medical. There's a lot of approvals that are needed before we can use that data to make clinical inferences. And so I agree with that, I suppose. But I personally think, I'm bullish on these tools as they get better. We've chatted with Oura. We have some others coming on the show, I'm sure. I think there's still a huge opportunity, particularly when these tools will then be able to integrate with a triage bot, if you will, that allows people to adopt them. And then the last thing I'll say about chatbots that came up as well, and I would say the crowd was pretty bullish on chatbots as a tool, but noted that a health system can't be reimbursed for that service, if you will. And so should we ever get to a point where CMS or other payers would reimburse a health system for, running a patient through a chatbot, a triage bot, we could probably see a lot larger prevalence of it, particularly as these tools are getting really good, right? They're not necessarily here to replace humans, but should be thought about as the first step in creating better access and directing people to the right space. And so I thought it was a great discussion. And what's really cool about Sanford's event is they host it in their event barn, which I think I talked about last time. So it's literally this beautiful barn that I would assume maybe a donor has put some money behind on their beautiful corporate campus just outside of Sioux Falls. And so it seats about 200-300 people, beautiful washrooms in the back, excellent sound, and super well produced. And so kudos, I would say, to the Sanford team. When it comes to key takeaways, what I would say is kind of what I've always said relative to rural health is that rural health systems, because of their necessity, in my opinion, innovation is baked into their DNA. And so I think urban and metro systems can learn a lot from people like Sanford Health. They have to be innovative because the constraints are so high. They have to think about things in a new way. And then was really happy to hear also that Sanford Health is working on building a standalone virtual care and innovation center, which I hope to get a tour of at some point. Maybe we can convince them to get a tour as well at the healthcare app and record some podcasts down there. And they also have an innovation unit up in Fargo. So they have a whole unit as part of their hospital that they do a lot of demonstration and education with. And so I thought that was really cool. So all in all, it was good. And, in typical our style, we met some fun friends. And so I want to give a shout out to Mathilde and Elliot from Dandelion Health, who are a partner as well to Sanford. And they've been working with them on aggregating their data to start to think about how to use it in research. And I'm totally oversimplifying what they do, but it was nice just to meet people and everyone that's involved with the Sanford Health Network. And we had a good time, went to a few dinners, had a few drinks down in Sioux Falls, which is a lot cheaper than Chicago. Let me say that. I'm sure way cheaper than Vegas. And so for anyone that was looking to do maybe a little summer tour or little vacation, check out Sioux Falls and see if you can get the team at Sanford Health to come and show you around. It was a pleasure to be down there again.
Great opportunity.
And really to encapsulate it, Bill Gasson, their CEO, got up and greeted everyone and said to kind of encapsulate the whole conference, he said it's virtual. In a lot of cases, it's either virtual care or no care at all, which I think really hits home just how rural parts of Sanford Health are. And so totally agree.
Final thoughts as we looked at both of these events. One thing that came to mind here as we've been talking about both shows is definitely along the lines of one of our themes this season, which is engagement. What does that look like? And I think being able to add up the sum total of what engagements look like, how they're different, how they're enabled, how they're designed. We seem to be going through a bit of an evolution here in how a health system sees the value of engaging somebody in between episodes of care. And I think the more we see that, some of it will be reimbursed, some of it won't. I mean, I think that's what came to mind of, maybe a chatbot doesn't reimburse in the same way. So do we emphasize that in the same way? There's always been this strategy of looking through that lens of what gets reimbursed. So you do have to look through that lens. Innovation has always called on us to understand that as the base and then still look at like what's coming, understand enough of what people's needs are that we are meeting by engaging in certain ways, and then not wait for it to happen. Go out there and get it. Go out there and implement that solution, design that service, create that experience. And I think we both saw that type of thinking, like the mindset that's actually going to get us there and keep pushing us, because we all know the status quo. It's like gravity. It just keeps bringing health systems back down to earth. It just keeps, saying, just stay the same. Just wait till somebody else does it. And meanwhile, people need care. So we can't just let the status quo stay there. So I love that thought. That was definitely one theme that I thought of as we're both sharing what we saw.
I think for me, what I observe at Sanford is, for whatever reason, I think maybe just because it's kind of a newer topic for my own brain, but I was zooming in a lot on the AI and the large language models. And what I realized sitting there is we may be closer than we think to starting to get to truly personalized care. And so as these bots and tools are deployed on these massive data sets, and some of this comes from our dinner conversation with Dandelion Health, we can literally get to the point where, hey, we know Jared probably has X, Y, and Z, or has a propensity for X, Y, and Z, clinical indications or issues or cancer, God forbid, or whatever it might be, right? And we're going to have that knowledge sooner than the system is able to do something about it. And so I think there's going to be this really awkward tension over the next few years as these LLMs get smarter and smarter and smarter and more data comes into it. It may be the case where health systems are going by necessity, have to pivot real quick. Because what happens when, I'm not exactly sure how it would happen, but XYZ number of their patients now know that they have this marker or this propensity or that. And now they're reaching out for services, right? Like, hey, I need help with managing maybe a potential cancer coming down the road or a chronic disease. And so my understanding is that these LLMs are able to take all these different data points, things you couldn't even imagine, and figure out that, hey, patients who end up with X disease or X condition also, 2 or 3 years ago presented like this, right? And so over dinner, we found out that, this one tool was able to diagnose cancer, breast cancer, 4 to 5 years before a radiologist could see it, which is crazy to me. Crazy. And so what does that mean when that information becomes more ubiquitous? It will turn health systems on their head overnight. And I think disruptors will probably be the first to be able to start to think about actually doing something about it. And so again, I think the data and the insights are going, I guess to summarize, what I'm actually saying is the data and the insights around personalized care is going to manifest a lot quicker than the ability to do something about it. And that's probably going to be an industry challenge we're going to have to face over these next few years. Maybe I'll remember to say this in our prediction episode at the end of the year as well.
Yeah, hold on to that for sure. Those predictions episodes are right around the corner. Perfect time to bring that up and perfect time to wrap up this conversation. I'm sure will be the last time that we're referring to events and conferences that we've attended, but I'm glad we were able to catch up on these two and report from the road and hear what it made us think of. We'll be sure to keep doing that as we attend more conferences this year and into the new year. In the meantime, we want to thank everyone for listening again, and thanks for joining me, Zain. It's been a pleasure as always.
Good to see you. Glad you had a successful travel as well.